health question. I appreciate your concern. What is health? What is dying? And of course, as I keep coming back to it, clinical courses are very difficult to predict with precision. And an illness that can make a woman ill can very quickly kill her. But it is our difficulty in exactly predicting clinical course that gives us difficulty. Therefore, I think we should err on the side of making sure that women are safe and making sure that appropriate, timely decisions are made. I don't think it's appropriate that a woman must be dying before she qualifies for a termination of pregnancy. And indeed, when we look at maternal deaths, a significant proportion of them are related to women who have other diseases during pregnancy, like cystic fibrosis, like bleeding disorders. And I think we have to acknowledge that when we look at risks to women. So really, I think what's required is sound clinical judgment. And there has to be trust in society that doctors and women will come to make a good decision that will keep women safe. In most cases of pregnancy, women really want to be pregnant. I've seen women risk their lives in order to have a baby. So it is not really about the risk of dying that makes women suddenly want to terminate a pregnancy. These are often babies that are really wanted, but women become sick, too ill, or at risk of dying. But as a clinician, we are charged with getting complex clinical diagnosis right in what can be a very narrow therapeutic window. And I bring you back to the example of ruptured membranes at 14 weeks. Very little chance that that baby is going to survive. But there's a significant risk for that woman that she will develop infection called choriamnitis. This infection is where the pregnancy itself becomes the infection. And she is at a substantial risk of dying. And the only way to treat that infection is to terminate the pregnancy and to give antibiotic. But when we have a clinical suspicion of choriamnitis, we won't get the confirmatory microbiology results sometimes for about 48 hours, so we must make a clinical decision. Therefore, doctors are concerned that if they intervene too early, that maybe it wasn't a real choriamnitis, they got it wrong, and maybe they're at risk of a custodial sentence. But if they wait too late, and young women often decompensate very suddenly, they appear much better than they are, and they can appear quite well and actually have very advanced infection, suddenly decompensate, and now you're in a position where you have to conduct a termination of pregnancy in a woman who's very ill indeed, and that can be a very narrow therapeutic window. And so doctors are charged with getting it right. So somewhere in society we have to accept that women and their doctors will make responsible decisions that are there to protect life.
Thank you. I'll move